Okay, Unit 11, vital signs are also considered in this unit because it's cardiorespiratory. There are 5 vital signs: temperature, pulse, respiration, and blood pressure. Those are considered objective information because you actually get a number with them. Pain is the 5th vital sign we include, and it is considered subjective because it is something that the person, resident, or patient tells you. Reasons for taking vital signs: we're looking for signs of illness, we're looking for potential health problems, and we're looking for a response to treatment. We never guess on vital signs. Report abnormal vital signs to the nurse immediately. Here are some of the things that you need to know. The first box is temperature sites. There, of course, is you can take a temperature orally, rectally, axillary, tympanic, or temporal. And then there's different ranges. In the United States, we use Fahrenheit. In other countries, a lot of them have switched to Celsius. But you can see that the rectal runs a little bit higher, the normals go higher, and the armpit and the tympanic run a little bit lower. So normal pulse rate is 60 to 100 beats per minute, and your normal respiratory rate is 12 to 20 breaths per minute. And these are the basic that you need to know on TPR, temperature, pulse, respiration. Report abnormal vital signs to the nurse immediately. This is blood pressure. Okay, so normal, we have a systolic, which is your top number, and diastolic, which is your bottom number. Systolic, you want it to stay below 120. You see the top in there is 119, and below 80. We see the top number on the diastolic is 79. And then, so that is normal, 120 over 80. And then low hypertensive would be a systolic below 90, and a diastolic, that would be hypotensive. I shouldn't say hyper. That would, and diastolic below 60. Elevated would be 120 to 129 on the top, and less than 80 on the bottom. Stage 1 would be 130 to 139 on top and 80 to 89 on the bottom. Stage 2 is 140 or higher, and the diastolic of 90 or higher. So with all that being said, when you're taking a blood pressure, generally you would want to report anything if the number on top is higher than 140 or the diastolic is higher than 90. It's a hypertensive crisis if you're taking it and the systolic is higher than 180 or the diastolic is higher than 120. Low temperature is called hypothermia. It's where the body temperature is below level required for normal functioning. Fever is an increase of body temperature above normal range. It may indicate illness or infection. The symptoms could include fatigue, headache, chills, muscle aches, warm skin, and flushed. You guys know what it feels like to have a fever. The main sites for temperature checking, again, were oral, rectal, axillary, tympanic, and temporal artery. So what you need to remember from this is the oral is your most common site. Your rectal is the most accurate site, and the axillary or the armpit is the least accurate. There are different types of thermometers. There's a glass mercury-free thermometer. They used to have mercury in the middle of those glass ones, and they are no longer make those because mercury is dangerous and toxic if they break. So if there's a glass thermometer, it should not have mercury in it. It'd be a mercury-free type substance. There's digital thermometers, electronic thermometers, disposable thermometers, tympanic again. Tympanic is the ear, which comes from tympanic membrane, which is your eardrum. And temporal is the forehead, because your temporal artery is on your forehead. Fahrenheit and Celsius, there are 2 different scales used to measure temperature. And then, like I said, in the United States, Fahrenheit is the most common used. When you're taking a Does the red or blue color coding on thermometer matter? Yes, red equals rectal and blue or green equals oral. So if you're using one of the electronic thermometers, you need to make sure you're using the blue insert. Do not use oral site if the patient is unconscious, using oxygen, confused, having a seizure, have an injury to the face, an NG tube, or younger than 6 years old. So in the nursing home, there is a lot of confused patients. You go to put a thermometer in their mouth, they're not going to let you do it. So you're going to most often have to use either the forehead or the axillary. Oxygen, a lot of them are unconscious. A lot of them have their mouth open and are unable to close it. And if they can't close their lips tightly around the thermometer, then you're not going to be able to do it orally. Wait 10 to 20 minutes before taking a temperature if the resident has been eating or drinking fluids, or if they have just smoked or been chewing gum or exercising. Pulse. So a pulse is the wave of blood through the artery as the heart contracts. Terms to learn is tachycardia and bradycardia. Tachycardia, tachy means fast, so it would be a pulse rate above normal. And brady means slow, so it's a pulse rate below normal. So what would be above normal would be anything over 100 for tachycardia, and anything below 60 would be bradycardia. Sites used to measure the pulse. You have a handout on that, and it's one of your homework or one of your things to practice on the different places where you can take a pulse. Pulse points are your carotid, which is in your neck, your temporal, which is on your forehead and the temporal area. Apical is where is your heart. That's putting the stethoscope over your heart. Brachial is where you check it for the blood pressure, which is in the bend of the arm. Radial is where you take regular pulse, which would be along the thumb line. Femoral is in the groin area. Popliteal is behind the knee. And pedal is on top of the foot. Right here is a picture of where you would put your fingers to do a radial pulse. And radial pulse is the most common. So it's inside of the wrist on the thumb side. When checking for a pulse, observe for pulse rate, number of beats in 1 minute, the pattern, whether it was regular or irregular, and the quality, whether it was weak or strong. Respirations is 1 breath in and 1 breath out equals 1 respiration. Respirations are counted after the pulse. You would keep your fingers on the pulse site and count respirations for 1 minute. A person more likely to breathe normal if they think you're still not watching their chest and they think you're still taking their pulse. When counting respirations, observe for respiratory rate, number of respirations in 1 minute, pattern of respirations, regular or irregular, quality, difficulty breathing, noisy breathing, deep or shallow. Terms you need to learn: apnea, A means without, so it would be without breathing or not breathing. Dyspnea means difficult breathing, and eupnea means normal breathing. Orthopnea is shortness of breath when they're lying down, which is relieved by sitting them upright in the bed or the chair. Tachypnea, again, tachy means fast, so tachypnea is rapid breathing. Cheyne-Stokes is a irregular breathing pattern with periods of apnea followed by rapid, shallow respirations. Apical pulse is heard with a stethoscope. It's the left side of the chest, just below the nipple line. It's used when it's hard to feel a pulse, or it's weak or irregular, or on infants and children less than 2 years old. It's taken to compare apical pulse to pulses elsewhere in the body. Pulses should be equal throughout the body. Blood pressure is the measurement of force on the blood against the walls of the arteries. Systolic is the top number. when the heart is contracting, and diastolic is the bottom number when the heart is relaxed. Hypertension is high blood pressure, or when the blood pressure is above normal limits. Hypotension is below normal limits. Orthostatic hypotension is a drop in blood pressure when a person changes position from lying to sitting to standing. So sometimes you'll get a doctor's order that says, I want you to take their pulse, lying, sitting, and standing, and then to get the different comparison. If it drops, that you could have, that means they have orthostatic hypotension. Sometimes it means they're a little dehydrated. Dizziness or fainting may occur. Equipment needed to take a blood pressure. I'm going to stop there.